Alicia Fernando and her sister Hashini are being tested for dengue. With a neighborhood full of patients and the girls getting fever, their parents are not taking any chances.
Dengue is spreading fast in our area and we're afraid because they got fever, so we came.
THUSHAL's concerns are shared by thousands of Sri Lankans, like those visiting this military-run lab set up in a local church.
We have been assisting the hospitals by constructing temporary wards and providing manpower and setting up laboratories like this.
Soldiers have been deployed to help with efforts to contain the outbreak. More than 72,000 people have been infected with the mosquito-borne virus so far this year. 215 have died. Government hospitals in the worst affected areas like the Colombo South Teaching Hospital are already at bursting point, some with 2 patients to a bed and others waiting in corridors. Private hospitals are also struggling to cope. It's past 9 p.m. and Dr. PRIYANKARA JAYAWARDEN has just arrived at Asiri Hospital for his evening rounds. It's the hemorrhagic patients who are the concern.
Usually, traditionally we think when you get 10,000 patients of dengue, we thought only 100 go to this category. But this time we see lots of patients with leakage. I think that our calculation may be wrong. We have to think that we have to expect more serious patients with this epidemic.
Critics point to a garbage crisis in the capital Colombo that's led to breeding grounds for mosquitoes. But the city's chief medical officer says people need to do more to protect themselves.
The biggest challenge, people do not look after their own backyards and also their own households.
Inspection teams have been cracking down on offenders in recent weeks. Those found with mosquito breeding grounds must pay fines or face prosecution. While this activity helps, a leading authority on dengue says a new strain of the virus is to blame.
We are a population that has been exposed to dengue virus. Therefore, our population, when they get the dengue virus with a new strain, because they are not immune to, then their chance of developing severe disease is high.
Despite the high number of infections, Sri Lanka has a low mortality rate among countries with hemorrhagic fever. But authorities say they are bracing for the worst in July when infections tend to peak. Minelle, Fernandez, Al Jazeera, Colombo.